with you some perspective on our progress in building regional learning networks across CPC+. We also want to thank the Milbank Memorial Fund and Lisa Watkins for inviting us to come and speak to you today and share some of this perspective. Let's advance this slide. So, oops. I'm sorry. Here's part of what we'd like to try to accomplish today. We'd like to give you an overview of the Regional Learning Network, an overview of CPC+, and then also the Regional Learning Network, and then review our progress to date in building those learning networks. These questions to run on are a technique that we use during the learning sessions in the Regional Learning Networks, and we thought we just use the same technique. We provide you with some questions to think about and consider during our presentation. So these questions are sort of designed to frame the presentation that follows. So let me start with a overview of CPC+, and we'll do this quickly, but we just want to provide an overview of the model and how the Regional Learning Network fits into that overall framework. So this is a little quick summary of CPC+ by the numbers. It's a 5-year project that began in January in 2017. We have another set of starters coming on, as we're calling them, in 2018. CPC+ has 2 tracks, which we'll detail more in a moment, but the tracks really dictate the care delivery capabilities that practices will need to develop and the payment structures that they will receive. And as you can see, there are nearly 3,000 practices participating in the 2017 model year starting, and over 2 dozen payer partners as well. These are the 5 core functions that the primary drivers for CPC+. Practices are required to focus on these drivers as the core mechanisms for primary care transformation. So they really have to focus on access and continuity, care management, patient and caregiver engagement, comprehensiveness and coordination, and then planned care and population health. So in some respects, there's just a lot for practices to try to take on, and as Ravis sort of hinted, the National Learning Network focuses a lot on the what in terms of these basic drivers, and the Regional Learning Network focuses a bit more on the how. So this slide provides a bit more detail on 2 of the drivers, and the next slide will continue. But as you can see, the track 1 practices are required under access and continuity to basically empanel their patient population, to provide 24/7 access, and to have assigned care teams to sort of meet the drivers for access and continuity. And then there are additional requirements under track 2 under access and continuity that have to do with sort of non-traditional office visits, if you will, or alternatives to the traditional office visit. Similarly, for care management, you can see the requirements for track 1, and then also the requirements for track 2. For comprehensiveness and coordination, there's a focus on identifying high-cost, high-volume specialists and in timeliness of notification and information about transfers between ED and hospital utilization. For track 2, part of the comprehensiveness requirement is it focuses on behavioral health integration, which is very much a focus for many of the practices these days, as well as collaborative care agreements focus on psychosocial needs, and the development of the practice's capability to meet the needs of high-risk populations. Certainly, the requirements for patient and caregiver engagement sort of focus on establishing a patient and family advisory council within the practice, as well as other capabilities to support patient self-management. And then finally, a focus on planned care and population health as well. Again, these are sort of the focus, if you will, of the practice transformation efforts across the practice. So that is the overview of CPC+ and sort of our focus in the Regional Learning Network. And so let me talk a little bit more about how we try to support practices in their efforts to sort of achieve this practice transformation. First, this is kind of a sense for how the components of CPC Plus fit together. As you can see at the core are these regional practice networks that we are trying to establish and support them through the regional learning networks. The national learning community sort of surrounds that effort as well. And as Raven noted, sort of focuses on the what, while we sort of focus on the how and how to get these things done. And really what the regional learning network is about is building and sustaining these regional learning networks across the 14 and soon to be 18 regional practice networks. And basically to support the practices in the efforts to sort of transform either through track 1 or track 2. And we try to accomplish that through several mechanisms, which you'll hear more about in a moment, but a lot of it is focused on coaching practices through change, supporting practices through in-person and virtual networking and learning and sharing opportunities among practices within their regions, and then engaging with payers and other stakeholders to support CPC Plus and the efforts of practices to do this transformation. These are the key tasks that we have taken on in building the regional learning network. In addition to building and sustaining the regional practices and the regional practice networks, we are responsible for understanding sort of effective cross-regional learning and really sort of how do we sort of teach across region as well as within regions. How do we help practices and the regional learning networks sort of focus on data-driven practice improvement? How do we identify patterns of care and tactics for better outcomes within each of the regions and sort of transfer those and engage in knowledge transfer both within regions and again across regions? How do we promote regional alignment and payer engagement across the regions as well? And then finally, we have to sort of do all the administrative tasks and coordinate with our CMS partners on building and sustaining it and the rest of these tasks as well. So this is the regional learning network team, and we thought we'd just give you a sense for what it looks like. It's led by the Lewin Group and TMF, as Raven noted. We also have 10 regional partners that operate within the regions. They sort of serve as the boots on the ground, if you will, in helping us to build the regional learning networks to understand where the practices are and sort of also acknowledge where the practices need. So really what we have is a structural regional learning network team that leads and coordinates activities for each of the 14 and soon to be 18 regions across CPC Plus. And I think the other thing to sort of emphasize here is that this is just a very large project that necessarily has a lot of staff and many partners that we kind of have to coordinate with and work with to provide this assistance to practices. And these are the examples, I think, or the range of activities that we try to accomplish across CPC Plus to support practices. So Raven sort of mentioned some of the live events that happen at the national level, including affinity groups and practices in action, as well as national webinars and office hours to provide support directly to practices. At the regional level, the regional learning sessions are in person and virtual, and another means of support. There's also opportunities for networking for practices to sort of work with their peers through CPC Plus Connect, an online platform that has sort of regional boards for each of the regions, as well as other regional networking opportunities that happen at the learning sessions and elsewhere. There's lots of communication through newsletters and Q&A on CPC Plus Connect as well. And then the other support is really through the scheduled check-ins and coaching opportunities that happen within each of the regional learning networks as well. So I wanted to focus just a little bit more specifically on some of these activities, particularly from the regional learning network perspective. And this is our timeline, just to give you a sense for how we kind of had to hit the ground running. The contract for CPC Plus, the Regional Learning Network, was awarded in February 2017, and we really sort of dove right in and began sort of in March of 2017 to do local launches and really try to engage partners immediately in the process. That was quickly followed by 2 learning sessions in April, May, and June, July to try to kind of catch up on the calendar, if you will. And then we sort of went in Q3 for the 3rd set of learning sessions as well. And then this is the continuation of the timeline for the rest of 2017 and also for 2018. We're sort of looking forward to having, if you will, a sort of regular cadence now that we've kind of caught up on the calendar, if you will. But we are planning for additional learning sessions in 2017, as well as sort of the start of 2018 across the original 2017 regions, as well as those 4 new starter regions of 2018. I wanted to also just spend a moment talking about how we sort of pick the topics for the learning sessions, because this is very much a data-driven process, but also one that we try to be very thoughtful about in terms of trying to incorporate both the CPC Plus drivers and sort of what's required of the practices, as well as what's going on regionally and what's driving sort of considerations at the regional level that might be important in terms of selecting learning section topics. So we really start with the local context in each region and function on sort of the local knowledge of the practices and their challenges that come from our practice facilitators, as well as other regional partners. We try to also focus on the IT and data infrastructure that's in place and sort of what other considerations might be driving sort of where the practices are and where they need to go. And then we look at the CPC Plus drivers and try to combine those with the regional context factors to generate those patterns of care and those key tactics that will drive success in primary care transformation at the regional level. Further, we try to incorporate all the evidence that we have on hand, either from CMS through claims data or other data sources, as well as what the practices are telling us in assessments that we are doing with them on a regular basis, as well as also what the local payer partners are telling us as well. And so all of this really comes together to really drive the topics that we select for the learning sessions, particularly early on. And so the early learning sections really focused on helping the practices get up and running and really get started on sort of the key transformation elements for year 1. So they focused on care management and patient engagement early, as well as care management again and behavioral health integration in the second set of learning sessions. We're expanding that a little bit and building on that platform to focus on social needs and using data to drive improvement, including the regional feedback report that's provided by Medicare. By CMS, because we really feel that's a very powerful tool for practices to get set up. And again, that sort of data using data to drive improvement feeds very well into the care management tasks as well. Finally, we're going to continue that in the 4th set of learning sessions for this year. The other thing I wanted to kind of focus on a little bit is to talk a bit about the coaching activities in the Regional Learning Network. It's without question probably the most important component of the work of the Regional Learning Network, but it's also kind of the one that's most unseen, if you will, in many respects. There aren't sort of public faces to that coaching. As part of our effort, though, to monitor coaching activities, we require all of the practice facilitators in each of the regions to complete a coaching support log that records their activities with the practices. And we take the data from these logs and summarize them on a regular basis and report those back to our partners at CMS. And just to kind of give you a slight summary, if you will, from period May 15th to August 31st, the Regional Learning Network had over 3,600 interactions, coaching interactions with practices across the CPC Plus regions. So there's a lot of activity that happens, sort of coaching directly kind of in person and virtually, or over the phone as well, where practice facilitators are going out to practices and guiding them through the payer feedback reports, for example, or helping them figure out how to hire a care manager or how to think about beginning their activities on behavioral health integration. And this is this bubble slide here is really provides a sense for the frequency of the core functions that appeared during coaching activities across the regional learning network. So as you can see, care management and comprehensiveness and coordination were really the focus for a lot of the CPC coaching activities early on, with planned care and population health and patient and caregiver engagement sort of following next, and then access and continuity. We found, particularly with access and continuity, that a lot of the practices were ready and sort of ready to go on those, and so they needed less assistance and less coaching on access and continuity drivers. Finally, I thought I'd just talk a little bit about payer engagement to this point. And I should note that in many respects, our activities on payer engagement have sort of paralleled the activities of the larger regional learning network in the sense that there was kind of a slow ramp up and now in a period of really pretty intense activity to try to drive engagement with our payer partners across all the CPC Plus regions. I wanted to start with the CPC Plus driver diagram, in part because I think payer engagement really focuses on that aligned payment reform that's on the outer circle of the driver diagram, and really kind of supports, if you will, all of the drivers and all of the activities and functions that occur within the CPC Plus model. So this kind of wraparound effect, I think, is really important and really sort of stresses the role that payment reform could have and should have in sort of aligning the activities and the drivers within the CPC Plus model. It also tends to focus on strategic use of practice revenue and really sort of helping practices, if you will, transfer them from fee-for-service models of revenue to other more enhanced models. As well as also focusing on data exchange and the role that data plays, particularly in supporting care management and other care activities. Here are our specific tasks for payer engagement. I'm not going to read them to you, but we have sought to try to create opportunities for regular engagement between payers and practices, particularly in the in-person learning sessions. We want those face-to-face meetings to happen fairly frequently and see that as an opportunity to really promote collaboration and an opportunity to come together to discuss how to best to support practices in their efforts to do transformation and get started in the process to sort of address challenges and problem solve together. And so those have been a really important set of tasks for us to focus on. And finally, we really try to make sure we understand what is happening at the regional level, particularly with other kinds of activities in sort of regions or states, for example, like state innovation models or other transformation activities that are happening at the state level that might have some impact on CPC Plus or influence practices or even payers in particular ways. And this is really how we've tried to engage with payers specifically. So as I mentioned in the in-person learning sessions, we've tried to have payer practice leadership sessions, either as plenaries or breakout sessions, to give payers and practices a chance to kind of talk to each other, address challenges and issues, talk about agenda setting going forward. We also have what are called regional network management meetings. These are monthly meetings of the leadership in each of the regions to try to, again, sort of share progress, lessons learned, engage in planning over the next set of learning sessions, kind of coordinate activities across the region, ask questions, problem solve, and brainstorm within these regional network management meetings. We've invited our payer partners to all these regional network management meetings starting in May and June of this year and continuing now through the summer, and really have sought to use that as the primary mechanism to engage with the payer partners going forward. In addition, there are plans for payer practice leader meetings on top of the learning session and the regional network management meetings. So that is our presentation. I wanted to try to keep it brief, but we're happy to take questions and also look forward to the discussion that might come. So Lisa, I think I'll turn it back over to you.
Okay, thanks very much. Thanks for a great presentation, Tim. Just right away, just wanted to give Corey and Elizabeth, who are Tim's colleagues at Lewin, an opportunity just to add anything else before we open the floor up for questions and comments.
Thanks, Elizabeth. Go ahead, Corey.
Go ahead. No, go ahead, Elizabeth.
All right, this is Elizabeth. I'm the project director for Lewin. I think Tim summarized it all, but we are here to answer your questions, and we look forward to active engagement in the future. Corey?
You said exactly what I was going to share. So thank you, Tim, for the great briefing.
Great. Okay, well, thanks very much. And one of the great things about these meetings is that we do have representation from many of the regions here, some of whom will be starting in 2018, but some of whom have actually been involved in the CPC previously, and also in that multi-payer advanced primary care practice demonstration where a lot of regional learning had to take place, although without this particular infrastructure. So I wanted to actually put one or two of my colleagues on the spot, and Dr. Richard Schank is on the line with the Health Collaborative in Ohio, has a great deal of experience in this work in the CPC Classic and now with CPC Plus. And Dick, would you mind just maybe saying a few comments about your recent experience with the Regional Learning Network in Ohio?
Sure, yeah. And hi, Tim, and good to actually finally see you. He's been a voice on the phone for a couple of months, so I actually get to see him, so it's good.
Thank you.
It's been a challenge, I think, to bring the payers in, and we've been fortunate in Ohio in that we did have CPC Classic, where we already developed some relationships in that arena, but and we learned a lot from that experience of payers are not all that they don't come forward very easily. And Lisa, you know this very well, and especially in each other's presence. There's a highly competitive environment, and to have them share a lot on the phone gets to be in a common meeting is problematic, and looking for ways to draw them out, I think, is one of our biggest challenges. But in general, I think that Lewin Group and TMF have been very helpful in our experience in engaging higher up the chain of command within the health within the payer communities, and Milbank has also been very helpful in that regard. So I think there's a lot of opportunity there, and something that we might be able to share some experiences that things that work and things that don't work. I think the payers, the other thing I would share is that, and one thing I have to constantly remind myself of is that it's kind of keeping the lanes clear. Since we do claims data aggregation, that is here at the Health Collaborative for all of the payers, we have that lane and that work that we do. CMS is a participant in that as a payer, but it is it's distinct and separate from the learning networks that we are doing under our CPC Plus contract. So trying to keep those lanes straight, yet at the same time getting, when I'm talking to a payer, I'm talking to a payer, and sometimes that relationship to be able to talk a little bit more about their participation in the learning work as well. So it's all good. It's just a matter of kind of keeping it straight in your own head so that you don't cross over into territory that you shouldn't at a certain time. So I think that, basically has been our experience, is that the payers are very interested in this work. It's been my experience in talking, and in fact, we're going to be coming forward with the story for CPC Classic probably within the next month or 6 weeks. And the data looks great in the aggregate. Some of the payers tell me it looks even better for them, especially in their Medicare Advantage world. And I think that that's why they're very interested in going down this road further with the learning networks. They want to see more of this in practices. They want to, they like the partnership. They like what they're seeing in their own data. So right now, I think the momentum is good.
And Lisa, if I may, I'd like to put a little context around Dr. Shank's remarks, and I'm pleased to see you as well. I think one of the things to keep in mind is I won't say that Ohio is extreme. I will say that it's the most ambitious effort, I think, across the CPC Plus regions, because there are 14 payer participants in Ohio. And so I think just getting those 14 individuals in the same room or around the same table at any time is always going to be a challenge for us. And so I think it's useful to keep in mind that, we sort of have a range of payer participation across the regions. And, in some regions, we only have one or two payers as well. So there are definitely different dynamics across the regions, and that's part of the challenge for us in payer engagement as well.
Good point.
Great, thank you very much. There's a question actually from our colleague and friend Diane Beekle-Marriott in Michigan. Diane, did you want to ask your questions?
Yeah, just curious about two things, and I really appreciate the discussion. One is about, you talked about 2017 priorities. I'm curious about your insight into 2018 priorities as a first question, and then I have one more if there's time.
You mean in terms of priorities for the learning sessions?
Learning network, yes.
Yes. Corey, you're probably the best position to answer that question.
Corey, are you on mute?
Did we lose Corey?
If I can find her.
Tim, why don't you talk about your priorities for the payers coming up, and
Sure.
see if we can get Corey back on the line.
I think the priorities for the sort of payer engagement piece really kind of focus a little bit on some of the challenges that Dr. Shank identified. I think we really want to try to create a culture of collaboration in each of the regions. As Reba noted at the outset, really part of the goal here is to build a sustainable regional learning network that, if you will, survives beyond CPC Plus, and we really see our payer partners as a key component of that effort. And so I think early on we've focused on trying to build those bridges, if you will, and really engage with payers, as we noted, through the learning sessions and the regional network management meetings, as a way of sort of introducing them to our activities in the regional learning network, beginning to get their input on the learning sessions, and sort of ask them specifically to become sort of, if you will, larger participants in the learning sessions. So in some regions, we are also working or beginning to work to sort of coordinate with the payers partners in the region who might also be out in the field, if you will, providing coaching the practices as well, so that we're not kind of stepping on toes or making practices have 2 meetings in 1 week or the like. And so I think through a kind of process of communication and inclusion, and really sort of trying to begin to agenda set as well as some coordination activities, those are really our priorities for the start of 2018.
I appreciate it. The second is a historical question. We were an MAPCP state and not a CPC Classic state, but my understanding is that the approach to the Regional Learning Network was a little bit different in CPC Classic, and I'd love to better understand that. If it changed in CPC Plus, or if the model was retained, or kind of what was different, what was similar.
This is Elizabeth. I'm really having a difficult time hearing you. I'm sorry. Could you repeat the question, and I'll be happy to answer it.
Sure. I'm sorry. I'm using my computer audio. The question is about, we were an MAPCP state and not a CPC Classic state. But as I understand it, and I could be wrong, the approach to regional learning networks differed a little bit between Classic and Plus. And I'd love to better understand that.
Sure, I'm happy to take that. So again, this is Elizabeth, and I'm the project director for the Regional Learning Network. There were actually some significant differences between Classic and where we are with Plus, and primarily because of what was mentioned earlier, the scalability that was required. There was a lot more what we call high-touch, one-on-one interactions with the 400 plus practices that were engaged with Classic. because of this is quite a different model with thousands, hundreds more than was originally in Classic, a lot of the activity does take place at these learning sessions in virtual communities online. And in 2018, there will be a lot of group regional practices gathering as groups. So primarily it's scalability that is the biggest driver and the change, while we are trying to keep to the fidelity of what works so well in Classic.
Thank you.
Thanks, Elizabeth and Diane. I'm going to turn over to Emily Seitz, who is one of a trio of conveners in Oregon, and she's just going to share some observations and perhaps a question for our speakers.
Can everyone hear me okay? I've got some headphones on.
Yeah, we can hear you just fine, Emily. Thank you.
Excellent. So we just had our practice learning session on the 19th of September here in Oregon, and we actually just had our monthly CPC Plus payer group meeting yesterday and heard some really great feedback from the payers of being able to engage in the practice learning session and have some great dialogue with the practices. I think everyone, their biggest takeaways was that they felt a really great collaborative spirit with the practices and talking about common challenges and having a better understanding of the challenges payers are dealing with and what practices are dealing with. And I think my biggest takeaway or maybe thought going forward is the payers are really anxious and hungry for more opportunities and more time to sit with practices and learn from them. I think we're trying to bridge that gap between the two, and it's still every little bit leads to a desire for more time together to discuss things.
Great, thank you, Emily. Tim or Corey or Elizabeth, do you have any response to what Emily just pointed out?
I'm happy to, and Tim, please supplement where you can. We think that a healthy system includes that interaction with payers. That's part of the reason that we're here. Of course, our primary obligation in the regional practice is those practices themselves. But I know that we are working closely with CMS and sort of in hammering out these priorities for 2018 to look for more ways that we can interact within each region with the payers, even beyond just the learning sessions. So stay tuned for that. And Tim, feel free to add anything else that you'd like.
Sure. I think the only thing I would add is I think you kind of hit the nail on the head. I mean, we really are thinking a lot about how do we build these networks, right? And how do we continue to sustain beyond the in-person meetings and the face-to-face opportunities, which are terrific for networking, but we really need to kind of keep that scale going even beyond, say, in-person meetings. And so the first thing I would say is we are certainly open to suggestions and would love to hear any ideas you all might have for how we continue to build those networks going forward. I think the other thing that has always concerned me is the last thing we want to do is put a lot of meetings on busy people's calendars, and so sort of walking that fine line, if you will, between really trying to continue engagement but not sort of overschedule, if you will, has always been a challenge too that we've always given a lot of thought to and really sort of kept in the forefront of our thinking.
So Lisa, this is Dr. Shonk, and I was just going to add in, if I could, I do think, and I agree with what's been said thus far, that there's a lot of opportunity for better and more interaction between the payers and the practices. I would caution, though, it's not for the faint of heart. And one of the things that we, and Lisa, you experienced this as well in the Millbank meetings, sometimes the physicians and the payers, especially the physicians, can get very upfront about their concerns, and they will end up bringing up things that you really have to be able to manage the conflict that sometimes exists in those settings. One of the ones that we just recently worked on is the fact that some of the payers, or many of the payers, tend not to go out and contract with the smaller independent practices because they lack the volume and they lack the essentially the market clout to get that. And so the smaller independent practices tend to suffer for lack of care management fees and can't reach that critical mass. What we found, and we just had in our virtual session, our learning and the learning or the practice payer learning session, was to have both sides present their case, and we had one of the payers talk about what are the characteristics, what are the things that they have to have in order to be able to credibly measure a practice's performance, what kind of volume is needed, what kind of criteria and capability on the part of the practice is there. And then we also talked about, okay, how can we get around that? Are there certain models that we could follow to make that work? So I just put that forward as an example of sometimes those confrontations are great opportunities to help promote understanding between the payers and the practices, so they understand the challenges each of them are dealing with and see if they can find out if there's a solution. So.
Dick, this is Lisa. Do you think that it's essential that conversation have to happen at least once in person? We're here on this webinar, and it's a relatively comfortable electronic interaction, but it's nonetheless, we're not all in the same room.
Are you asking me, Lisa?
Yeah.
I'm a big advocate for the in-person meetings, and we've actually talked to TMF and Lewin Group about possibly looking at having more in-person learning sessions. I also would like to, right now, because this Ohio, Northern Kentucky is the largest one of the regions in CPC Plus, with over 560 practices in it, it gets very difficult to do it in one setting, even in person. There's just crowd control gets to be difficult. So if you're going to have these conversations, it's sometimes helpful to have them on a more regional basis. So I'd like to have maybe a Northern Ohio, a Southern Ohio, and a Central Ohio type of session linked electronically. But we're kind of working that through, and TMF has listened to us, and I think we're just kind of figuring out what's the best venue to make this happen. But then there's also the budget, and there's only so much money to do this work. So it's a balancing act. But to answer your question, I think it does work much better in an in-person setting.
Right. Thank you. Yeah, I know that's come up in a couple of other regions as well that are geographically large, and it's a struggle to get everybody physically in the same place. So we really only have 1 or 2 minutes left on today's abbreviated webinar. I wanted to see if there are any other questions or comments that you'd like to ask while we still have our colleagues from Lewin on the line. Okay, with that, I really want to very heartily thank Tim and Corey and Elizabeth from the Lewin Group, and Reva and her team at CPC Plus for our wonderful presentation today. This has been recorded. We are having a little bit of a challenge loading things so that they're not hugely burdensome onto our website, but we hope to make that available. And if our colleagues are able to share their slides, we will also be sending those out as well. Thanks everybody for dialing in today, and we have another webinar next month. I'll send out information about that probably tomorrow. Thanks everybody, really appreciate your joining us today. Have a good day.
Thanks, Lisa.
Bye-bye.
Thank you.